So good evening, everybody. I'd like to call the May 1st meeting of the Albany County Legislature's Health Committee meeting to order. Roll call.
Ray Joyce,
Present.
McLaughlin, Beston,
Here.
Petto,
Here.
Miller is excused, Robinson, Lane,
Here.
Collins,
Here.
and Lockhart.
Here.
You have a quorum.
Thanks. Okay, the previous business, item number 1, TMP 6554, approving previous meeting minutes. We have a motion to approve the meeting minutes by Mr. Beston, second by Mr. Lane. All in favor?
Aye.
Any opposed?
Items 2, 3, and 4 are tabled at request of sponsor.
2, 3, 4 being tabled at the request. Move on to number 5, authorizing an agreement with Fells Hospital regarding morgue and laboratory services. I think that's how are you tonight, sir? How are you?
So we're just asking for another 2-year contract with the Ellis Hospital. We did reach out to Albany Med. They never, first they told us that they had never got our request, but we sent it again, gave them an extended time, and they still didn't respond in a timely manner. And I've heard that their fees were around $2,000, so about $800 per case more than what Ellis has been doing for the last 2 years, so they haven't raised their price for the next 2 years.
Thank you. Do you have any questions from the committee? Mr. Lane?
How many cases per year on average?
Around 300, a little better.
Any other questions from the committee? I'm sorry, Bob.
Go ahead.
No, I'm seconding your motion.
Okay, we have a motion by Mr. Beston, second by Ms. Lockhart. All in favor?
Aye.
Any opposed? Unanimous. Thank you.
Thank you.
All right, moving on to current business. Number 6, amending the 2025 Department of Mental Health budget and motor program. Good evening, Dr. Giordano.
Good evening, Mr. Chairman. Thank you very much. I'm joined by 2 of my colleagues who are here to add assistance if needed. Mr. Fitzgerald is our fiscal director. This is Adam Kirkman, who is a special projects coordinator in charge of our opiate settlement funds. And motor is first on the agenda. Yes? I don't know that I've come to you before to talk about our motor program, but it's a program that we're quite proud of. MOTOR is an acronym that stands for Mobile Outreach Treatment and Overdose Response. We had come to the Public Works Committee in September of last year as the first phase of this expansion project with use of opiate settlement funds. And we have 2 customized vans on the way. We anticipate their arrival in June or July. The goal is to maximize and enhance what we're doing right now. What we're doing right now is we do mobile outreach. We're connected to the Substance Abuse Clinic at the Mental Health Department. And we also are working with the Crime Analysis Center to be able to respond to police-reported overdoses that someone has survived. So right now we're working on the last few years with Colony PD and the Kilbourne PD, and every report that we get from them, we go and either knock on door or call them, and at times we're asked to leave the porch, and sometimes we're told, thank you for reaching out to us and helping. So we believe this is a very valuable value add to the community. It's a model for other communities. And phase 2 is what I'm here about tonight, asking to amend the 2025 budget. The amount is $966,388. It's for 3 years to add 3 new staff positions. So this would essentially give us 2 full teams of mobile outreach workers to continue this work.
Thank you, Doctor. Do you have any questions from the committee, Ms. Lockhart?
No, Doctor.
Hi.
Just, do your people carry Narcan?
Oh, absolutely.
But I've been hearing having trouble getting it. Is that true?
Uh,
Shortage? Have
You know, it's funny, we were just talking a little bit about this. I've not heard of any shortage for us, have you? We have boxes of it, and I think the health department, Lansing's here somewhere, I think we're both pretty well stocked now. And we've saturated the community, and we continue to do that, so.
Maybe that's why I'm hearing this short.
Well, as I'm talking, I'm thinking that could be part of that, but we've not seen any additional. Yes.
Yeah, and I think, you know, I did mention on the way in, I think the federal government's cutting 56 million in Narcan funds to states and counties, so that's something we're gonna need to look at, probably going down the road. Dr. Spetto?
You mentioned Colony and Gilder. Is that where this program is active, or was that phase one?
So this program is active throughout Albany County. So we work with the police departments, are with two of them right now, Colony PD and Gilderland PD. And we develop relationships with them, and we anticipate and want to expand to other police jurisdictions. But we only have one team of people, and we couldn't keep up with more than the two. And we've responded to Colony more than the Gilderland office, but hundreds of cases through Colony PD over the last couple of years, and many dozens through Gilderland.
So if it's a countywide program, but you're only working with Colony and Gilderland police department, then how do you?
That's not what I said.
Oh, all right, yeah, explain it,
It's a countywide program that we do outreach, we do linkage, we do referral, we work from our substance abuse clinic, and we will go out at the Lark Street Initiative from when we first met.
The Navigator
The
gives
motor-
references
the motor-
to this
The
program.
motor team was on that project, and we were going up to people, bringing people to rehab. We get calls all the time, separate from the police work. And they're also charged with doing community education, tabling events. So we're all over the place. But the police work, the overdose response work is with two police departments. So that part of the job is limited to those two. We hope to expand that to other jurisdictions, but we're all over the county.
Okay, so just a follow-up question, if that's okay. So if only if APD encounter has a situation like this,
Yes.
where do they?
Right, so they work right now with Catholic Charities, and they have a health hub. They do the exact same thing. They work with the Crime Analysis Center, and they report into they report overdoses into the Crime Analysis Center. They get we call it a vulnerable persons list, and it's like within 24 hours. So Albany is covered right now with the Catholic Charities Initiative. But I've already talked to the Albany Police Department about being able to support that effort in Albany because there's a lot more calls in Albany. So,
Great, thank you.
yeah.
Thanks, Mr. Spetto. Ms. Lockhart?
One more question? Dr. I'm glad to see his relationship with Chief Drossi. I know this is land.
We have a great relationship.
Yeah, he's terrific. He's doing a lot of good work out there. With the Crime Analysis Center, you're able to pinpoint where these calls are and get some data and so forth. I'm guessing that you're getting a lot of calls from Village Colony, 1600 block, Central Avenue.
I'd be glad to check that. I don't know that
Yeah.
for sure.
Could you forward some information to me about where you're seeing it? I'm also working with Chief Drossi on some other projects. So.
Sure. The interesting thing about the work with the police departments is that the information is not protected, whereas the EMS
Right.
responses we can't get access to.
But it's not so much names, right, it's just hotspots, that
Well,
I think is obviously.
right.
I know you can,
Understood.
It's different,
We can
yeah.
talk hotspot.
right, okay, thank you.
Thanks, Ms. Lockhart. Mr. Lane?
This is Dr. Jodo.
Yes, sir.
So this is coming from opioid settlement funds.
Yes.
Is this money being moved for any other use, or is this not yet been allocated?
Right, good question, because as I think you probably know, just the settlement fund money cancel plan previously, previously spent money or money attributed to other project. This is not committed yet, so this is new money.
Okay.
Mr. Landry, any other questions from the committee? Hearing none.
Make a motion.
Well, we have a motion moved by Ms. Lockhart, second by Mr. Lane, all in favor?
Aye.
Any opposed? Unanimous.
Thank you.
Thank you. Number 7, Department of Mental Health, budget for the second chance opportunities.
Right, so this one may remind you of a recent discussion we had in February. So, two things. One, the second chance opportunity is a recovery center. It's geared towards people who have already completed addiction treatment. It helps people get jobs and education and regain the life that they were putting in jeopardy with their drug use. We asked in February to be able to enter into contract with them, anticipating why I'm here today. OASIS, the State Office of Addiction Services, has given them, through us, $535,000 to operate their program. And as many of you know, we have a long-standing relationship, as does every county mental health department, with OASIS. The state funding comes through us as pass-through money. This is 100% state funded, and we already put the contract in place in February, and this is operating costs for them. The state has recognized them as an example of how a recovery center should operate, and they're funding them.
Do you have any questions for Dr. Giordano on number 7? Hearing none, we get a motion moved. Motion by Mr. Peston, second by Mr. Collins, all in favor?
Aye.
Any opposed? Unanimous. Number 8, amending the 2025 Albany County budget, the jail-based addiction services.
Yeah, there seems to be a theme here tonight. This is a little bit different, but also in the same vein as the 100% pass-through funding with Second Chance. A number of years ago, the New York State Office of Alcoholism Services decided that they wanted every jail in the state to provide a baseline of addiction care services. And they began funding, I think the first year may have been 10 jails, and then it expanded. Now it's every county in the state. Initially, this money that we're being asked to modify the budget, amend our budget this year, is to move money from Addiction Care Center of Albany, which had been doing this work in the jail. They're a long-standing trusted partner with us in the community. The COVID years affected everyone in many different ways. ACCA was not in the jail at the same level that they were being funded to do. OASIS took issue with that and wants to give the money directly to the sheriff's department. And in the interim years, the sheriff's department started providing this service on their own dime as ACCA kind of backed out. So this is the state's attempt to complete the promise that they made a number of years ago to fund addiction care services in jails. So we developed a way to move the money from ACCA to the sheriff's department in the amount of $278,450, which was the money that was previously in the ACCA.
Thank you, Doctor. Do you have any questions from the committee? Okay, hearing none. Before we take a motion, we talking a lot about addiction services tonight and programming. I just read that we had, I think it was $1 billion in cuts to school mental health grants and another $11 billion federal cuts to addiction and mental health care. Is the state, I think the assumption on the federal level is states and counties will pick up the tab. Have we talked at all with the state about how we're going to continue to fund some of these programs that are based on federal grants?
That is the question today, and it's certainly a fluid situation. I can tell you this, and we probably want to revisit it next month, because we're getting alerts almost on a daily basis from our state offices mental health, addiction, and developmental disability. We have already had one grant canceled in the middle, and then within 3 or 4 days said we didn't mean that, and you can go ahead and spend the money. I think that was taught us all, though, that could happen tomorrow. Right now, our services are intact. The state aid that we're getting is intact for the most part. We have a number of grants that we're watching very carefully, and we're in contact with the state regularly. Whether or not the vision that you're pointing to is where we're going, no one's said what you're hypothesizing, but that's certainly, if you read between the lines, that could be what's going on. I don't know.
I think many of these programs are expected to be funded through the year until January 1st, and then I don't know what impact it'll have on, you know, our job, our duty is public health, right? So we want to make sure if there's any risk to that.
And mental.
But, yeah, and mental health, that's correct, yes, but, yeah, I'm just trying to read the tea leaves on what's happening.
No,
at
I
the
appreciate
national
the
level.
question, and my pledge to you is that we will keep you up to date. It is really almost daily that we're getting scary emails and then calming emails.
Must be fun.
That's not the word I would use, but we're moving along.
Thank you, Doctor. Do we have any other questions on number 7 or for Dr. Giordano? Motion move or question?
A question.
Question or?
Kind of a follow-up on what the chair was asking about. I know it's hard or impossible to plan for this, but what types of strategies and worst-case scenario planning is happening at this point in time?
Right, so what I can tell you is that I appreciate that question very much. I'm not prepared to answer that right now, but I understand that I need to come up with an answer for that.
If we could get an update on that next month? And I know you said that you were going to keep us in touch.
Yeah, I mean, it's
monthly
moving
and-
every day, and there's a lot of money at play. All I can say is right now, every Albany County resident that we serve is getting the services that we promised to them. Moving forward, I mean, can't get
I
blood.
appreciate the
Yeah, you can't get blood from the stone.
uncertainty, but appreciate also that you're thinking in that
We
way.
are
I'm sure there's
thinking, yes.
discussions with the county executive.
Yes.
Thank you.
Thank you. Yeah.
Chairwoman
Yeah, the only
Cunningham?
thing I was gonna add to kind of the thread here between your question and Susan follow-up. At the Office of Management and Budget level, Dave Riley is very, very hard at work doing some, not just analysis, but pre-planning related to how much is not just direct federal funds, because when I've talked to him about this, if you look at our budget, and you would ask the question, how much federal funding do we get? It's a smaller percentage, but the other question is, how much state funding do we get that is actually federal funding? And that number is enormous. I mean, we are dealing with programs like yours are funded through the appropriation cycle, which ends September 30th. And then we're gonna have another probably dire kind of scenario where we're looking at a whole year of funding cuts for, mental health services. If they're not Medicaid, they're funded through that process. But there's a lot of analysis and kind of scenario planning that Dave Riley is doing, and they're on it. But I think they're probably more worried than you are.
Well, they probably are. But I will say, if I could, just to pick up on that, as part of Commissioner Riley's being on it, he has asked this group multiple times to go line by line through our budget.
Yeah.
What's federal via the state, what's mandated, what's not mandated. So I suppose that's kind of the beginning of contingency planning. Let's think, but we don't have answers. But right, you guys have looked through the budget multiple times already.
Thank you, appreciate the candor. So we still need we have a motion for number 8. Mr. Veston, second by Mr. Collins, all in favor? Any opposed? Thank you, Doctor.
Thank you all.
Next up is the Department of Health. Number 9, authorizing an agreement with the New York State Department of Health regarding the Drinking Water Enhancement Program and amending the 2025 Department of Health budget. Welcome back.
I'm back.
How are you?
Okay, great, open the row seat here. Thank you. We are asking for the committee to allow us to enter into a contract with New York State Department of Health for the Drinking Water Enhancement Program. We have had this for a number of years. This is just a new 5-year commitment. It's $110,690 per year with a total of $553,450 for the 5 years. And this program basically allows our department to monitor and oversee the public water supplies in Albany. And we, monitor the data that they send us, make sure they're following the regulations, New York State regulations, and so on and so forth.
Do we have any questions from the committee? Mr. Lane?
Is this actual testing or?
We typically don't do testing. The water districts do most of the
they
testing.
report back?
And they report to us. They're required by law. Yes, that's correct.
Do we have any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Ms. Petto, second by Mr. Lane, all in favor? Any opposed? Unanimous. Number 9, an authorizing agreement with the New York State Department of Health regarding drinking water enhancement. Oh, I just did that one, I'm sorry. Skipping all the lines here, can't see. Number 10, authorizing an agreement with the New York State Department of Health, AIDS Institute Health Research Incorporated regarding an expanded partner services program.
This too is a renewal of a contract we've had for many years. This would fund our expanded partner services program. Basically, it is where we identify individuals who have tested positive for HIV and have not been in care, and we assist them in linking them to medical care and also their partners. We do prevention, education, and a variety of other things in this, with this particular grant.
Thank you. Do we have any questions from the committee? Question?
Yeah. Those are internal services or are those contracted?
These are internal.
Thank you.
Any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Beston, second by Ms. Petto, all in favor?
Aye.
Any opposed? Unanimous. And finally, number 11 is public hearing. Thank you. Public hearing of proposed local law number B, 2025, a local law of the County of Albany, New York, amending chapter blank of the Albany County Code, setting forth requirements that the Albany County Department of Health notify local officials regarding enhanced containment levels found in drinking water in Albany County.
So I can go first. This is the public hearing for local law B, which I would love to see this committee move out. We moved it out of law last night. The version that is on Granicus is the updated version that we have been working with the exec's office, with Mary Beth, with Max, who's the environmental health expert. And so there are some material changes in the new one that reflect the good work that DOH as well as the exec have added to this. Some of the edits, the top lines are, and I know this is just the public hearing, but we did remove language regarding testing of soil, and I think there was some discussion of air quality testing. The department doesn't do that kind of testing, DEC does, so it wasn't practical for us to include that. So it focuses on water testing, which is on occasion what the department does. And this kind of connects to a real life kind of water communication challenge that we had in Bethlehem, where we were having lots of issues with our water. that related to this algae bloom that was causing problems in our reservoir. And then a subsequent event that was kind of unrelated happened in New Scotland where there were complaints about a farm using biosolids that prompted the county exec to actually do the moratorium. But there was some complaints by some landowners about their well water quality. So DOH came out, tested, which they do upon request to do testing of well water. Come to find out, I didn't know this at the time, I don't think our town supervisor knew it, but the location of those wells was 2/3 of a mile from our reservoir. So, so at that point, and of course, Mary Beth and her team notified New Scotland, not realizing, I think we all found out at the same time, gee, they're very close proximity. So the point of this is notification if DOH is doing that kind of testing, to not just notify the municipality, but the adjacent municipalities. So DOH did some really good edits that make it more operational. We changed the language in the elevated levels to reflect the testing that DOH gets from the New York State DEC as well as any other federal agencies. We also trimmed down the list of who would be notified. We had a good conversation with the exec's office about just the number, the volume of people. So we kind of trimmed it down to reader, you know, you can see what the list is. It's still an extensive list. People will get notified. If it's in your legislative district, you will get notified. So we trimmed that back a little bit. And we are also going to be changing the language that removes the notice by mail and just keeps it email. Email's fine. A letter, who knows when it would arrive and how long it would take to get open. So emails from DOH, I'm sure, are read very quickly by our local leaders. So we made those changes. Love to see the public hearing be reported out, and then we'll go back after that to review the notification.
Chairman, question, Ms. Lockhart?
I'd like to be added as sponsor. Make a recommendation for that.
Do we have any questions? Hearing none, can we get a motion? Motion from Mr. Besson, second by Ms. Lockhart, all in favor? Oh.
You'll hear from me.
I apologize, we have to amend the date to May 27th.
Oh, right, sorry about that.
No worries.